So yes, I'm a PhD candidate from the University of Calgary, Faculty of Veterinary Medicine, and this project was part of my PhD thesis where we're looking at pain and inflammation associated with difficult calvings in beef calves. So why this is important is because about 9% of all beef calves in Western Canada are assisted at birth, and these calves are at sort of have increased risk of being born either injured, oxygen deprived, or having both issues when they're born. And these assisted calves also have a higher risk of having failed transfer of passive immunity, as well as morbidity and mortality in the pre-weaning period. We also know that from some studies from producers and veterinarians alike that difficult calvings are perceived as painful, and currently NSAIDs are the favorable choice for treating pain in cattle worldwide. We also did some previous research where we looked at subclinical trauma in association with calving difficulty. So we looked at calves of different calving difficulty, unassist, easy assist, and difficult assist, and found that calves that had difficult assists had higher quantitative amounts of trauma. So we measured creatinine kinase and aspartate aminotransferase in those calves, and so they had higher levels of tissue trauma. And we also found that those calves that had higher levels of trauma, there was an association between the trauma and a decrease or poor vigor in those calves. And then leading to the calves with poor vigor, they also had an increased risk of failed transfer of passive immunity. So we believe that there's some sort of trauma going on in these calves, and so one of the ideas is to potentially treat them with an NSAID to help decrease that trauma or pain that they might be experiencing. So, thank you. So our hypothesis was that administering meloxicam at birth to assisted calves would decrease physiological indicators of pain and inflammation, as well as improve passive immunity, health, and growth in these newborn beef calves. We enrolled 33 primiparous cow-calf pairs that required assistance from 2 different farms in southern Alberta. We collected a lot of information, especially at birth, so we collected information on the calf's sex, birth weight, if the calf had meconium staining, the presentation and posture of the calf. We also then categorized the calves into a calving score. So easy assists were considered calves that were delivered by one person pulling to deliver the calf, and then a difficult assist was considered 2 or more people pulling to deliver the calf, or mechanical assistance such as a calf jack to deliver that calf. At birth, the calves were randomized to either meloxicam or placebo treatment. We used subcutaneous meloxicam at 0.5 milligrams per kilogram dose. And then we subsequently took blood samples from those calves at birth, 1 hour, 4 hours, and 24 hours. We measured a lot of different things through the blood samples and taking other information. So when looking at physiological indicators of pain and inflammation, we wanted to measure L-lactate, haptoglobin, cortisol and corticosterone, substance P, and then other physiological indicators such as heart rate, respiratory rate, and rectal temperature. We also wanted to look at passive immunity, so we noted whether the calves stood on their own by 1 hour and whether or not they got up and nursed from their dam by 1 hour. And then we measured serum immunoglobulin concentrations at 24 hours of age. This was run by radioimmunodiffusion assay, and then we took those concentration numbers and categorized them into an optimal passive immunity score. So there are 2 current papers looking at beef calves, and they both found that 24 grams per liter was the cutoff point where beef calves had a reduced risk of morbidity and mortality in the pre-weaning period. We then looked at health and growth outcomes, such as whether or not the calf was treated for disease in the pre-weaning period, mortality, and then we measured body weights at 1 week of age and weaning to calculate average daily gain. So this table is just showing all the different things that we measured at the different times. We took baseline samples at birth, and then we repeated those blood samples and other samples at, again, 1 hour, 4 hours, 24 hours, 7 to 10 days, and then weaning. For statistical analysis, we used Stata 14.1. We ran linear regression models, exact logistic regression models, and then for our repeated measures, we ran mixed multivariable linear regression models. We also offered farm ID, so whether or not they were born on farm A or farm B, their calving score, so whether or not they were in easy or difficult assist, and the medication that they received. So did they receive the meloxicam or placebo as covariates to every model. This table is just showing the demographics by medication group. So we have the placebo-treated calves here and the meloxicam-treated calves here. And you can see that they're fairly well evenly distributed by farm, breed, and calf sex between the two treatment groups. And then we also have their birth weights down here. And again, they're fairly evenly distributed between the two treatment groups. For results, so we measured a lot of things, and when we discussed some of the physiological indicators of pain and inflammation, so looking at the L-lactate, the haptoglobin, cortisol and corticosterone, and substance P, we did not find any statistically significant differences between the meloxicam and the placebo-treated calves. Similarly, we didn't find any statistical differences between passive immunity, so whether or not the calves stood by 1 hour, nursed by 1 hour, and their serum immunoglobulin concentrations, and also with whether or not the calves were treated for disease or if they died. In comparison between the meloxicam and placebo groups, we did not see a statistical difference. But we did find some interesting things that will require further investigation on other studies. One is when we looked at respiratory rate, we did see a significant difference between calves that were treated with meloxicam and the placebo, but there was an interaction between the medication that the calf received and the calving score, so it has to sort of be interpreted with some caution. The other thing to note is that these mean respiratory rates are within normal limits for a neonatal calf. And so even though we may have found this difference, it's sort of hard to interpret when you're starting to think about biological significance as well. And this may be due to our small sample size in this first study and measuring so many things. Also interestingly, we looked at average daily gain at 1 week by medication group. So this table, or this graph is showing, so we have average daily gain here on the y-axis, and the gray box is meloxicam-treated calves, and the white box is the placebo-treated calves. And calves that were treated with meloxicam did have a significantly higher average daily gain at 1 week of age. So they gained 0.9 kilograms at 1 week of age compared to 0.6 kilograms for the placebo-treated calves. When we looked at average daily gain at weaning, we found similar results. So again, we have average daily gain here on the y-axis, and then the gray box is our meloxicam-treated calves, and the white box is our placebo-treated calves. And again, we found a significant difference where meloxicam-treated calves had a significantly higher average daily gain at weaning compared to the placebo-treated calves. So some things we have to note, because this was a fairly small sample size and there are some study limitations. So we did only enroll 33 cow-calf pairs. Again, the cows were all heifers. And when we did some post hoc analysis, we were underpowered with this study as to potentially detect a significant difference. The other thing that we have found through our studies is that neonatal physiology is incredibly complicated and not well understood, and there may be other multiple factors that are affecting these calves, such as hypoxemia or acidemia, that may also affect some of these physiological indicators that we tried to measure. The other thing is that trying to identify neonatal pain is also quite difficult because you have these multiple factors and other things that are going on, and there's so many things that are going on during parturition that can affect how that calf may experience its birth or show symptoms afterwards. But in conclusion for this study, we believe that meloxicam given to assisted calves at birth may be an important management tool for improving production, such as growth in these calves or well-being in these assisted calves. But we would also like to perform future large field trials to further investigate the associations of NSAID use in these assisted calves and how that might impact their health and productivity. We actually have a trial that we'll be presenting at AEBP in 2 weeks where we did enroll 230 calves and randomize them to either a placebo or a meloxicam treatment at birth and follow them through till weaning, trying to look at some of these health and production outcomes. And so with that, I'd like to thank my supervisors, Claire Windier and Ed Pager, as well as my committee members and technicians that helped me collect all of this information at all those various times, as well as all the funders for the project. And with that, I will take any questions. Thank you.